Bacterial vaginosis. So, this bacterial vaginosis is a common vaginal infection, and previously it was called as bacterial vaginitis, but now it is called as bacterial vaginosis because vaginitis means there should be presence of inflammation. But here in this condition, there is no inflammation, so the term vaginitis was replaced by vaginosis. So regarding the etiology of bacterial vaginitis, so there'll be bacteria which are normally present in the vagina, and when there is an imbalance and decrease in the naturally occurring bacteria of the vagina, there'll be bacterial vaginosis. And in bacterial vaginosis, the number of normal lactobacilli will decrease, and there'll be simultaneous increase in other bacteria like anaerobic bacteria. So normal lactobacilli means they are also called as Dodeline's bacilli. So, bacterial vaginosis is caused by imbalance and decrease in the naturally occurring bacteria of the vagina. And in bacterial vaginosis, the number of normal lactobacilli or Dodeline's bacilli decreases with simultaneous increase in concentration of other types of bacteria, especially anaerobic bacteria. And the causative organisms which predispose to this bacterial vaginitis include Gardnerella vaginalis, Ureaplasma ureolyticum, Mycoplasma hominis, Peptococcus, and Mobilancus. So, regarding the clinical features of bacterial vaginosis, the clinical features include moderate malodorous grayish white homogeneous discharge which is adherent to the vaginal wall, and there will be no evidence of vaginal inflammation. So regarding the diagnosis of bacterial vaginosis, for diagnosis, Amsel's criteria is used. AMSEL, Amsel's criteria is used in AMS. So here for diagnosis of bacterial vaginosis, out of these four, any three should be positive. So first will be grayish white discharge. The second is vaginal pH more than 4.7, that is alkaline pH should be present, and whiff test means drop of vaginal discharge is mixed with 10% KOH, and if it produces a fishy odor due to release of amines, acridin, and putridin, it means the fishy odor means it is a positive whiff test. So that is also a criteria. And the fourth criteria will be presence of clue cells in the smear that is prepared with normal saline. These clue cells are diagnostic of bacterial vaginosis. The clue cells are nothing but they are the vaginal epithelial cells covered with coccobacilli, and the cells appear as stippled or granular. So regarding the diagnosis of bacterial vaginosis, Amsel's criteria is used. So out of these four, any three should be present. That is grayish white homogeneous discharge, vaginal pH more than 4.7, that is alkaline pH, whiff test positive, that is a drop of vaginal discharge mixed with 10% KOH will produce fishy odor, and the fishy odor indicates positive whiff test. This fishy odor is due to release of amines, acridin, and putridin. And clue cells in the smear that is prepared from normal saline. Clue cells are diagnostic of bacterial vaginosis. Clue cells are vaginal epithelial cells covered with coccobacilli, and the cells appear as stippled or granular. So, regarding the complications of bacterial vaginosis in pregnancy, there are three main complications in pregnancy, which include preterm labor, premature rupture of membranes, and chorioamnionitis. And regarding the treatment of bacterial vaginosis, metronidazole is the drug of choice for bacterial vaginosis. Metronidazole 400 mg thrice a day for 5 to 7 days is the drug of choice. Locally, clindamycin and metronidazole gel can be used, and probiotics are given to increase the number of lactobacilli in the vagina. Lactic acid wash is given to maintain the pH of vagina to prevent a recurrence. So, to summarize, the bacterial vaginitis is a common vaginal infection. The term vaginosis is preferred over vaginitis because there's no vaginal inflammation. And regarding the etiology of this bacterial vaginosis, the bacterial vaginosis is caused by an imbalance and decrease in the naturally occurring bacteria of the vagina. In bacterial vaginosis, the number of normal lactobacilli or the Dodeline's bacilli decreases with simultaneous increase in concentration of other types of bacteria, especially anaerobic bacteria. The causative organisms which act synergistically include Gardnerella vaginalis, Ureaplasma ureolyticum, Mycoplasma hominis, Peptococcus, and Mobilancus. Clinical features include moderate malodorous grayish white homogeneous discharge which is adherent to the vaginal wall, and there's no evidence of vaginal inflammation. And regarding diagnosis, Amsel's criteria is used, and any three of these four should be present. That is grayish white discharge, vaginal pH more than 4.7, which means it is an alkaline. It should be an alkaline pH. And whiff test positive means drop of vaginal discharge mixed with 10% KOH will produce fishy odor. If fishy odor is produced, then it is a positive whiff test. This fishy odor is due to release of amines, acridin and putridin. And clue cells are diagnostic of bacterial vaginosis. These clue cells are present in the smear that is prepared with normal saline. The clue cells are vaginal epithelial cells covered with coccobacilli. The cells appear as stippled or granular. Complications of bacterial vaginosis in pregnancy: preterm labor, premature rupture of membrane, chorioamnionitis. The treatment of bacterial vaginosis includes metronidazole as the drug of choice. Metronidazole 400 mg thrice a day for 5 to 7 days is the drug of choice. Locally, clindamycin and metronidazole gel can be used. Probiotics are given to increase the number of lactobacilli in the vagina. Lactic acid wash is done to maintain the pH of the vagina to prevent recurrence.